So
Okay,
Dr.
Dr.
Jalal
Walid and
is
the
going to,
panelists,
yeah, thank you.
good morning, and attendee, good morning, and thank you very much for having me today. And my talk will be innovative approaches in reviewing presbyopic corrections. And the objective is to explore current and emerging presbyopic correction methods, highlight innovative technologies and techniques, identify clinical research gaps. Presbyopia, age-related decline in near vision, prevalence 25% of population, 1.8 and billion projected to rise to 2.1 by 2030. A major focus of innovation in optical, surgical, and pharmaceutical science. And this graph will show the distribution of prevalence of myopia in different countries, and I will be interested in the lower one, which showing the existing people who are wearing spectacles and the people who are not wearing spectacles. Therefore, there is a room for all of us to work on that, and we need, to do it professionally rather than just, leave people to choose from cheap spectacles and to approach also the new techniques in presbyopia. Pathophysiology, loss of lens elasticity and accommodative ability, age-related changes in crystalline lens and ciliary body, typical onset between 45 years, and depends on the race, and it depends on the demand for near vision, lens, and also the refractive error. Lens cross section with aging effects. That's the study showing the changes in the lens according to this study, and I believe people can go to it because of the time. Traditional correction methods, spectacle reading, bifocal, multifocal designs, contact lens, mono vision and multifocal options, limitation, adaptation, optical quality, convenience, and also when we say convenience, enter the commercial, the affordability, and the other factors, glasses and contact lens comparison. That's again, not everybody will go to contact lens. However, there is a market for that, and there is people who are asking for contact lens. LASIK and LASIK modification for near. Also, this area, I'm not, ophthalmologist to talk about it, but I would expect, people, they have done work on it, and there is a problem with the optics of it, if you like, and corneal inlays and refractive lens exchange, multifocal and accommodating intraocular lens, also an area where the surgeons will be interested, and obvious method and innovation in correcting presbyopia. We have got myotic drops, that's pilocarpine-based VT and lens softening component compounds, future direction, anti-galaxiation and lens elasticity restoration, also an area. And I believe, some people, they prefer, to take this route and use it as a mean of correction. When we come to the percentage and what is people are doing now, I think 55% of the people, they're going for spectacles, where contact lens 15 and surgical correction 10, and multifocal IOL is 10%, and pharmaceutical treatment 10%. I'm not, convinced with this distribution, because I feel even from our practice, if we look at our patients, we will find even more than 55% are using spectacles. Okay, and even when we say, spectacles, some people, they go just and buy spectacles, and some people, they come and seek your advice on their spectacles and the type of lenses that they are using. And the reason we are presenting something like this, we would like to do correction professionally, rather than just, leave it for the people to choose from whatever available for them. This will take me to the technological innovations, adaptive optics, and smart lens prototypes. And we know that there's companies and they are working on the types of lenses that be comfortable and wavefront guided, extended defocus intraocular lenses. Also an area where we find it, especially in intraocular lenses, because at the end of the day, when you would like to read, you are not going to read vertical, you are having an angle. Therefore, the top line and the bottom line, you don't need accommodation. Therefore, this is the defocus, and obvious this will be extended in when you have got intraocular lenses. AI assist modeling for personalized correction, also an area to be considered, and digital and diagnostic advances enhance aperitometry and ocular biometry is an area where need to be looked at. Vision simulation tools and teleoptometry platforms, again an area, and digital fitting and patient education interfaces is a job for us to consider, whatever your position in the eye care grade or panel, if you like. And comparative insights, that's comparing safety, reversibility, and efficacy across techniques, meta-analytic insights, and patient preference data, trend tools, non-invasive and combination approaches are important, because you need to just only 2 slides. Okay. This will take us to the future direction: bioengineer and accommodation intraocular lenses, gene and regenerative therapies targeting accommodation, nanotechnology in ocular materials and drug delivery is an issue. And here, clinical implication, patient selection, lifestyle, visual demand and expectation, counseling and shared decision-making critical, continuous follow-up, long-term data monitoring, and the gap in research, limited long-term comparative studies, inconsistent pharmaceutical efficacy data, socio-economics and accessibility disparities in treatment adaptation, and conclusion: no single method it fits all. Personalization is a key. Innovative strategies integrate optics, pharmacological, and AI. The future of presbyopia correction is multidisciplinary. Innovation in presbyopia correction is not about one perfect lens. It is about personalized vision. Thank you very much.